probably all of you will have noticed, is really the only plenary that we have during the course of these 2 days. And we've singled this out for a number of reasons. One, because obviously COVID, the issue, is such a salient issue. I can't think of any other issue that comes up more often in the discussions that we have, both in terms of planning and in our work, than that of COVID. It's also a piece of work that I think probably virtually everyone in the coalition has been involved in. As I'll mention in a few minutes, this has been an exhausting effort that's taken place, that's involved interviews and consultations with literally dozens and dozens and dozens of organizations. So many of you have probably already taken part in the discussions concerning it. And I think the third reason is because our hope is that the findings and the conclusions to come out of this and the recommendations to come out of this will find their way into your own thinking and your own implementing mechanisms and working groups as you begin to put meat on the bones of our work plan. As we'll see towards the end of this discussion, there are a series of recommendations that have emerged, and our hope is that these will find their way in the discussions that take place. I would, though, like to say a little bit about the genesis of this activity. It goes back really to the beginning of the pandemic, or really within weeks of the world sort of coming to a standstill back in March. In early April, we hosted a call. We convened a call from representatives, manufacturers, governments, donors, implementing partners to look at and sort of address the impacts of COVID-19 at that early stage of the pandemic. We had a tremendous turnout for that call. I think we had something like 50, maybe even 60 people on that call, and we were hearing the stories that at that time were really circulating widely: the suspended manufacturing, difficulty sourcing products, price increases, price gouging already at that early date, increases in lead times, the inability to fulfill orders. We were hearing about travel restrictions. And we were also hearing about limitations to client access and demand for sexual reproductive health services as a result largely of the stay-at-home orders that had been put into effect early on and really was affecting the world as a whole. I think one of the things that emerged from that call, and many of you, if you think back to that period of time, there were concerns over what do we do next. And there was really a sort of divergence. There were a number of people who were arguing, this is a problem we need to deal with now. We know what the problems are. We know what the challenges are we're facing. Let's put into place strategies, remedial actions that can address the problems we're facing now. There were others who were saying, really right now, we're not at that dangerous a situation. Things will get worse, probably towards the end of the summer. And this kind of created a kind of dual conversation. There were some who were afraid to take action because they were afraid that the actions that might be taken now would, excuse me, just drop my paper here, would prevent longer term strategies in the future. There were those who said, well, we don't really have time to wait for the future. So this was in many ways kind of the genesis for us coming together with JSI and with funding from the Bill and Melinda Gates Foundation to be able to follow up on that call, to be able to identify the supply chain constraints and risk exposure, with a vision for really developing a community roadmap for action. Early on, we put together a technical advisory group that was made up from leaders from diverse program areas, all of the key reproductive health areas, family planning, maternal health, menstrual health, safe abortion, but also some of the technical areas as well in terms of supply chain, in terms of the role of the private sector. To help shape and guide really the overall trajectory of the work in building this roadmap and planning for the future. The assessment itself, as I said earlier on, was really based on more than 50 key informant interviews, but also a really deep dive into last mile challenges in 3 countries, in Kenya, in Zambia, and Ethiopia. And as I mentioned earlier on, I think a lot of you who are on this call right now were probably interviewed as part of those discussions. Last week, we sent out the final report that summarizes the finding and lays out a community action plan to strengthen this end-to-end supply chains for sexual reproductive health products. And really the focus of this action plan is to accelerate the adoption of practices that worked well in 2020 and that address those disruptions or weaknesses that pose the greatest threat to widespread reproductive health product availability in the short term and long term. The format of this session will be largely in 2 parts. The first will be to share the high-level findings that were shared and distributed. The report itself was sent out earlier last week. And then we have 2 key individuals who were absolutely instrumental and indispensable in producing this piece of work. Alexis Heaton from JSI and Anyona from inSupply Health in Kenya, who really both were very much involved in this work and who will provide an overview of the process findings and recommendations of it. What we are going to do is then after the presentation, we're going to entertain a number of questions that were sent to us in the aftermath of the report going out last week. And so we have a series of questions, but as I'll mention later on as we get to those questions, if there are questions that people have, particularly after hearing the presentation, that were not addressed during these questions that will be presented in the chat box, please do send those to us, and we will collect them together and respond to them. So let me begin by turning the floor over to Alexis and Johnson for the presentation of the key findings. As I said, Alexis is the Senior Technical Advisor at JSI and the lead on this activity. And Dr. Anyona is an analyst with inSupply Health based in Kenya. And he also partnered with the Ministry of Health to lead the data collection and analysis in Kenya. So I turn over the floor to the 2 of you.
Great. Excuse me. Thank you, John. And for everyone, I just put a link to the report in the chat if you're curious to see it and haven't had a chance yet. And let me go ahead and share my screen. As John said, we're going to try and keep the presentation part relatively brief, so we do have time to get to questions and answers, but do want to give you just a sense of what we were able to find this past year. And I should say, Johnson and I are here representing this work, but it represents the work of quite a few team members, both within JSI and talking in RHSC and talking to many of you as participants in the ministries of health in Zambia, Ethiopia, and Kenya. So we're very grateful to everyone's involvement throughout this process. So just to, John mentioned a fair amount about our approach. In July 2020, we undertook a 6-month rapid assessment of the effects of COVID-19 on SRH supply chains, wanting to identify some of the short and long-term opportunities based on what we learn about what worked well in terms of the response to COVID-19, as well as what was revealed in terms of underlying vulnerabilities. To do this, we were trying to look across all the categories of products within SRH, knowing it's quite a diverse group of products. So trying to look at what similarities and differences emerged related to family planning, maternal health, menstrual hygiene. Our approach also was really to look at the supply chain from end to end. So starting, conversations with the global level, understanding the perspectives and experiences of international manufacturers, procurers, donors, freight forwarders, wholesalers, Ministry of Health staff, both supply chain and programmatic, social marketing organization, distributors, and others all along the supply chain. And also looking at the various functions of the supply chain, as you'll see listed along the bottom here of this slide. And our methodology was because we were trying to do this so rapidly, it was very opportunistic. So looking at existing sources of data, looking at quantitative data from 6 electronic information systems, and then supplementing what we could find from those 6 countries, looking at 3 countries to really go in depth to understand the context in the 3 countries we've already listed. Our data collection took place between August and October 2020, sort of understanding what had been the experience during the acute crisis and what people saw as the ongoing concerns. So, as was said in the beginning, I think we all know COVID-19 has disrupted everything. And so, what we found will not be surprising to many of you. You've lived this, and this is sort of our experience collectively for the past year. But I think one of the things that we found, obviously, all aspects of the supply chain were disrupted, and that those effects rippled across the supply chain, and that there were effects at every single aspect, even if the disruption occurred somewhere else. What we found generally is that the COVID-19 timeline in 2020 can really be broken down into a few key time periods with varying effects and timing across different geography, given how the pandemic evolved. The first 2 to 4 months were characterized as more reactive and crisis management as organizations and countries struggled to respond to the disruption. It was characterized by sudden changes, uncertainty, and in some cases, confusion. What we found, though, was within 2 to 4 months, most countries, organizations, programs had moved into more of an adaptive phase. This was a period of rapid adaptation to the new constraints and general recovery amidst ongoing adjustments, new waves of the pandemic, and continued efforts to limit disease transmission. What we heard about the disruptions were surprisingly consistent across sectors, countries, and product categories. In the early reactive and crisis management phases, the most common response to COVID-19 outbreaks in all countries was to restrict movement to reduce the spread of disease, which in turn had various effects on the supply chain and movement of products and information. This affected every aspect of the supply chain, from manufacturing, shipping, customs clearance, warehousing, distribution, service delivery, and client demand. Lack of information about the location of lockdowns, quarantines, and testing protocols, combined with unknowns over the movement of products, introduced significant uncertainty into the supply chain. This uncertainty created more ripples that affected all operations. The pandemic also meant that governments, companies, organizations, and individuals needed to rapidly buy and ship large quantities of PPE and other COVID-19 related materials to ensure the safety of staff and populations, and added significant costs to operations and procurement. Many respondents that we spoke to mentioned the immediate and longer term funding shortfalls and pointed to the diversion of funds to procure COVID-19 related products and to cover the added freight costs and distribution costs. We talked to private sector partners and heard about shortages of cash flow and pivoting to carrying more high turnover goods like masks and hand sanitizer that were sure to sell. Others mentioned shifting to holding higher levels of inventory to buffer against uncertain lead times. Responsiveness to the disruptions was also affected by the availability of information. Many supply chain actors spoke about the importance of data for decision-making and the uncertainty and risks of managing without it. For instance, guidelines suggested that in preparation for long-term disruptions, governments and other customers should place orders sooner rather than later. Yet few systems were equipped to rapidly sense and adjust to pandemic-related demand changes. Demand was affected as facilities were closed and guidelines were changed, but no one knew exactly how or how much demand had shifted. This increased the risk of supply decisions being based on outdated trend information, which could exacerbate rather than prevent stock imbalances. Everyone we spoke to was dealing with some sort of disruption along the supply chain. Even local manufacturers relied on inputs from other countries, and their delays limited their production. And what we heard over and over again was the importance of communication and coordination, especially during this time. This became invaluable throughout supply chains for problem solving and finding a path forward, but it also required significant amount of time and resources. However, within that 2 to 4 month period, what we did hear is that organizations had resumed operations, albeit with new constraints. So we were very interested in the impact of these delays and disruptions on stock levels and stockouts within the countries that many of us are interested in. Our analysis of data from 6 countries indicated that stockout rates were generally not higher during the very acute pandemic period of March to September 2020, for which we had data, than in the periods preceding the pandemic. We looked at stockout data by country and product category month by month from January 2019 through September 2020, and found that stockouts decreased or stayed in line with previous rates for many of the programs and products. So that doesn't necessarily mean that there were no stockouts during this time. It's just that the rates of stockouts that we saw were not significantly different than what we had seen prior to the pandemic. However, towards the end of our analysis period, we did see trends that suggested that rates of stockouts were beginning to increase. And so it's unclear whether this upward trend is something that would be an ongoing risk, or if it's more in line with fluctuations that have occurred in the past without COVID. So we were very interested in sort of understanding, given the scale of the disruptions, why we didn't see more changes in stock levels and stockouts. And so Johnson will talk a little bit more about, specifically what we found in Kenya in terms of a national response in that setting. And I'm just going to spend a few minutes going through some of the global level responses that we think helped mitigate against some of, more severe shortages and stockouts. Generally, we found that in 2020, supply disruptions were minimized for a few key reasons. The first is that funding and donor cycles that were already in place meant that procurements for 2020 were already in progress, meaning that funds had been allocated and in many cases, firm purchase orders had already been placed. So that meant that funding was not available to be diverted to COVID-19 response. The second is that there were rapid implementation of global and national policies that prioritized SRH products as essential. This helped break through some of the initial bottlenecks that were disallowing the flow of products out of some countries and into others, and then within countries in terms of distribution. A notable exception that we heard to that is that often menstrual health products were not included as part of this essential designation. A third reason is just the global level coordination and information sharing that took place. Some of this was ad hoc, just trying to rapidly problem solve, identify where there were bottlenecks and use the wherewithal that this community had to solve problems. Others were through more formal mechanisms like the Global Family Planning Van and using data to foresee and help coordinate efforts to prevent stockouts and shortages. A fourth reason was the flexibility with funding and policies. I think everyone, to the extent possible, the flexibility that was allowed really helped us and people in general respond to this crisis. This included flexibility with funding, so donors allowing the procurement of PPE or shifting to procure different types of products, the adaptation of working environment and what was required to continue operations, In some instances, we heard about being able, to extend credit further or longer terms to allow for overcome some of the cash flow issues that we heard about. Responsiveness to the higher freight costs. We heard from many people that, the freight costs that were being offered, far exceeded what would typically have been approved, but they were able to get, quick notice of rapid decision-making to allow those higher prices. And heard about new ways of reaching clients. So really rethinking, what's possible in terms of different ways of accessing and being able to continue to offer services. And then lastly, problem solving. I think what we heard over and over again was just the human resiliency and sort of the commitment to continuing to make products move and get things where they need to be, as well as the adaptation of standard operating procedures, processes to ensure that there were safe working environments so that work could continue across the health systems, and just really people figuring it out and how to get products where they're needed, even if it took a bit longer to do, and new ways of working together. So right now I'm going to hand it over to Johnson, who's going to tell us a little bit more about what we heard specifically in Kenya.
Thanks a lot, Alexis. So in Kenya, we got our first case of COVID-19 on March 12th, 2020. As the cases increased, the country went into a reactive phase where the stay-at-home messaging, followed by curfews and restrictions of movement in some parts of the country, were issued by the government. This resulted in lower levels of care seeking. There was limited health facility staffing. We realized that some facility staff were reassigned to COVID-19 response, and some health facilities were actually converted into COVID isolation centers. That added to the curfew hours, limited the hours of operation for health workers and also for warehouse staff. So the initial focus was, as was the case in many other countries, was self-preservation. The attention and priority shifted to procurement of PPE and ensuring sufficient COVID-19 related services. So if I can just read a quote here that you are seeing from one of our KIIs, he told us that the demand that came with coronavirus really shifted everything. Basically, family planning was third place, if at all it was on the table. There was need for an urgent response and preparedness for COVID-19, and family planning was not even considered as a priority at all. And then there was HIV programming and TB, which we knew was also going to be disrupted. So family planning was not considered an emergency at all. So that is what we noticed in the reactive phase. But following the shift to more of a crisis management phase as the pandemic continued, we observed the following effects in the SRH supply chain. In terms of procurement, international procurements were delayed. There were higher freight costs and higher product costs in some cases. We got to learn of a marginal increase in the price of oxytocin. In terms of inventory and stock availability, the healthy stock position helped mitigate against the effects of COVID early on. So Kenya's central medical stores actually has a high maximum inventory level and of 16 to 22 months of stock. And this was able to mitigate against any delay that were experienced. And where there were delays, it was a matter of days or weeks and not months. In terms of distribution, our central medical stores acquired the status of essential service provider, meaning distribution wasn't affected, though order fulfillment was slightly affected due to reduced shifts of operation. In terms of demand for services, the lower levels of care seeking witnessed in the reactive phase recovered to pretty much pre-COVID levels, if not higher. As you can see on this graph to your right of your screen, we analyzed the changes in CYP, couple year of protection, which we derived from consumption data to evaluate the effect of COVID. So the graph you're seeing is CYP against time, and the light blue shaded area represents the period when COVID began. So there was a brief initial decline in CYP for long-acting reversible methods, that is IUDs and implants, but this returned to levels comparable with those before COVID. As for short-term methods, that is pills, condoms, and injectables, they were in line with trends witnessed before COVID-19. And this did not just happen miraculously. There were actually some mitigation efforts which were put in place by government and stakeholders, and I'm going to highlight just a few of them. So one, the government quickly developed and disseminated Rmnch Guidelines. Therein were strategies which were aimed at ensuring continuity of care in the context of COVID-19. For example, the government issued a directive that facilities needed to adjust their minimum stock levels from 4 to 6 months. And then there was prioritization of less skill-intensive family planning products, such as condoms and pills, and also multi-month dispensing to minimize the numbers that are coming into the facilities. Another mitigation effort was the directive by the government that SRH services were considered as essential services and their staff were considered as essential service providers, which allowed work to continue and facilities to remain open during curfew hours. A third mitigation strategy is the innovative use of technology to inform distribution of SRH products to where they were needed the most. For instance, there was a shift to virtual data review meetings. There was use of WhatsApp to inform redistribution at a time where in-person meetings were heavily and supervision were heavily discouraged. Next slide. So in our assessment, we rigorously looked at stock status, consumption, and stock out rates before and during COVID. We also included key informant interviews from public, private, and social marketing organizations. Although we were interested in data on family planning, maternal health, abortion services, menstrual health, and STI-related commodities data, in Kenya, there was limited data for products beyond family planning. There was also limited quantitative data in the private sector. So as a proxy for equity, we analyzed subnational stockout data to determine if some geographies were more likely to be stocked out than others. We discovered that there are no unusual trends observed during the crisis management period. That is, regions that were more likely to be stocked out after March 2020 were also those that had higher levels of stockout in the past. So overall, there are positive findings in terms of short-term disruptions to services. For instance, if you look at this graph on the top left hand of your screen, it represents the total modern contraceptive prevalence rate for all women of reproductive age in Kenya. So we noted that despite supply disruptions and dips in service levels in the early months of the pandemic response, our MCPR rates actually increased in the crisis management period. And this is actually consistent with data which was reported by the PMA survey of 2020, which showed that more women switched to longer acting methods and moved away from traditional or no methods. So thank you. That was just a preview of how the pandemic affected SRH supply chain in Kenya. I will now hand it back to Alexis to take us through the potential risks for the future and some ideas on how we can better be prepared going forward. Over to you, Alexis. Thank you.
Great. Thank you, Johnson. And I think, some of those findings were consistent. Obviously, we found we had different experiences in different contexts in Zambia and Ethiopia to compare and contrast with that. But I think generally the sort of story of recovery was somewhat the same. So as we were thinking about synthesizing this data, we realized that, this is a little bit of a good news, bad news story. We seem to have managed through 2020, but there are a number of weaknesses and risks that persist. And as we all know, we're still in the midst of this pandemic and not all of the effects are evident yet. So as we were thinking about both the new risks that had appeared, some of the, challenges that we already knew about that were exacerbated, and then some of the, general learnings around our supply chain priorities and some of the things that we all, have been working on in terms of more lean supply chains, it sort of brought together some things in a few key areas that we're thinking about. The first is looking at the markets. Our supply base for many SRH products is limited, both in number and geography, meaning we have fewer opportunities for supplier redundancy and greater risks to product availability and client choice. The focus, for the past years on price has left us all more vulnerable to disruption. The second big bucket is financing. Many of the people and organizations we spoke to talked about increased costs around supply chain operations and products. So freight, staffing, the need to continue to buy PPE, increased costs that have been added to products as they become more expensive and inputs become more expensive. During 2020, most people said these costs were being absorbed, but it was unclear how long that could go on without those costs being passed along. And these increased costs, coupled with some of the economic downturns that we're seeing and growing demand for COVID-19 related products and vaccine rollout and introduction, jeopardize sustained public sector funding for SRH products. And potentially jeopardize the viability of the private sector market, as we're seeing, as out-of-pocket payments may need to increase, but people may not have that ability to make those out-of-pocket payments. The third bucket is supply chain design. The logistics environment has changed. Supply chain gains will be threatened if we return to pre-COVID strategies without rethinking our sourcing, inventory, freight, and distribution systems, as well as new channels for products. Data is the fourth bucket. We have improvements in data systems, but even within the growth in electronic systems, data weaknesses persist. We have gaps in, large chunks of commodity data for maternal health, for menstrual hygiene products, for private sector products in many cases. And so COVID-19 and when we were trying to gather all this information really highlighted the need for more robust data systems that allow for rapid visibility to support informed decision-making and collaboration along the supply chain, especially when there's situations of increased uncertainty. And then lastly, the fifth grouping is policy and coordination. We really need to look at more opportunities for public and private sector partners to actively commit to coordinated efforts to strengthen supply chains and make products more available, particularly for SRH products. And we need to have proactive policies that promote the availability of SRH products even during emergencies. So putting those in place before the next emergency happens to ensure it's not a reactive effort. And so we need to consider all of these as we think about how to address the current challenges and prepare for the next disruption, whatever that might be. Which leads us to our community action plan. So for those of you who've been able to access the report, the recommendations, this goes into much more detail they start on page 61. It was a little too much to include in a very short presentation, but I think these are the 5 areas you see at the top are how our recommendations in the action plan are organized. And these relate to the 5 areas I just spoke about. And so I think, I hope you'll look at the full report and see the action plan specifics, laying out what we think is needed to strengthen overall supply chains for SRH products. And as we thought about these, there are just a few principles that I want to draw out that we had in mind. Number 1 is we don't want to lose sight of what did work well in 2020. When challenges emerged, many adjustments were made, workarounds were identified, and problems were solved. So how can we help institutionalize this mentality around problem solving as a routine supply chain management practice while strengthening systems to avoid the need to develop workarounds? Number 2, we're very, very aware that COVID-19 is ongoing. We know we haven't seen the full impact, especially financially, on what will happen to the availability and demand for SRH products. This is a moving target, so we need a way to be able to continue to monitor the ongoing macro and micro effects, especially with risks of second and third waves of the pandemic. And number three, we know there's a lot of great work going on already. So much has been able to change in 1 year, proving that things can change quickly when needed. So we don't want to lose that momentum to see what needs to be changed and do it to improve our overall supply chains and promote the widespread availability and access to SRH products. I think as you look through the recommendations, you'll see, these 4 principles on this slide around. Some of them we know are tackling some of the big challenges along the supply chain. We understand that some of these have perplexed us for a while, and this is, really an opportunity to come together. I think if nothing else, the pandemic has shown us that the big challenges really do require community effort together to address some of these challenges. And so I think we recognize that everyone, within RHSC has a role to play to help strengthen our supply chains, and that we can do much more if we're working together on these problems collectively than working in silos. So all of these are intended, we need everyone sort of focused on ensuring this and figuring out what part we can all play in this. And then I think there's a recognition, as back to the earlier point, that our supply chains, a disruption in one area affects another. These can't be tackled sort of sequentially or in a piecemeal approach. We really need to focus on all of these areas together to be able to make changes. And we know some of these recommended actions are already in progress or planned by RHSC members and stakeholders, and some are new and would require additional investments. But I think we really are hoping that this is the moment that we can all come together and think about which of these, our individual organizations or groups can help tackle, and how do we use the coalition to remain coordinated and really make progress against some of the longstanding challenges to strengthen our supply chains. So that's the end of the presentation part of this. So I'm going to hand it back to John to moderate Q&A.
Great. Thank you. Thank you, Alexis. Well, I see we're running fairly tight on time. We have about four minutes left under this session. So what I'm going to do is I'm going to combine question and answer with a final wrap up. And in fact, I want to kind of leave the last word to you. As I mentioned earlier on, as you mentioned during the course of the presentation, this work and the recommendations that came out of this really are a springboard for the broader reproductive health community to begin addressing many of the challenges that we've seen. And under our work plan, we do have resources that we've received to be able to support groups, to be able to further some of the recommendations, or those recommendations that are acted upon, to be able to address some of the concerns that you've raised here. And so I guess my question to you, in light of that, since you've been in the midst of these discussions for so long, what in your mind, as the groups break out and start thinking of these opportunities, what really are the recommendations that you feel are most critical to act on? Critical, feasible, and worth addressing in the course of the coming year.
Thanks, John. That's a tough one. I mean, we've spent a lot of time thinking about these recommendations, and I have to say they all are important, I think, and they all must be done collectively. And I think, like I said just now, there's a sort of a role we all have for helping to carry these forward. As we were thinking about supply chain resiliency and listening to all of the constraints and concerns, it became very clear that just focusing on one area alone would not be sufficient. For example, you know, a lot of people talked about their sourcing strategies and the need to have more diverse set of suppliers. But if you have a market where you only have 1 or 2 quality assured suppliers, there's not a whole lot of opportunity to diversify. Similarly, if your 2 or 3 approved suppliers get their API from the same source, you know, there's not a lot of, even if you know where your supplier's supply chain, it's really hard to diversify and really protect yourself against risk. Likewise, you know, if we don't have sufficient funding or good policy and stewardship in place, you know, SRH will continue to be relegated to an afterthought after, you know, while we're focusing on COVID-19. I think one of the things that, you know, is on our minds a lot is just, and like I said earlier, is the fact that the pandemic is ongoing, and that's a huge risk. What we found from 2020 and the recommendations that we came up with, you know, will help address some of the challenges, but we need to keep our eye both on the continued COVID response as well as, you know, continued availability and access to SRH products. And so I think, you know, some of these, they're all important now, but I think in the short term is really keeping an eye on those 2 things. So we're really not losing ground around SRH products while we continue to make sure that people are protected against, and we can sort of stop the progress of this pandemic.
Great,
So,
thank you. And I think, Johnson, I will probably give you the final word during this session. You talked during your presentation about some of the successes that we saw in Kenya in terms of mitigation efforts that were put into place that really yielded positive results. I think from the perspective of countries, since countries is, you know, really where we're coming from in looking at this, to your mind, you know, what are some of the biggest opportunities that you see at country level to make SRH supply chains more resilient, you know, based on what we learned from COVID-19? I think your input on that will be extremely helpful in helping guide the work of the implementing mechanisms as they start to think about strategies that could be put into place within their own constituencies.
Thank you, John. Good question. So I think one of I'll borrow this from the limitations that we highlighted. I think one of the limitations we have talked about is on data quality and data availability. So I'll give the example for Kenya. In Kenya, the logistics data that comes from facility level is not real time. So data is available much later because of the mix of paper-based and electronic system. So by the time the data gets to the decision makers, it's maybe 2 weeks down the line. So this means that data is not readily available to sense any changes in demand more quickly to be able to adjust and make prompt decisions. So the other issue is on data quality, which we noticed even in our analysis. Quality of data is actually wanting. In my organization, one of the indicators we track is the comparison between the ending and beginning balance of consumption data. And we've picked that there are a lot of variances in that particular indicator, signaling that the data quality is wanting. So to aid this, there is need for regular data review meetings to be able to pick out such problems and troubleshoot them. And that is actually something that we are doing in a few of the counties that we support. So therefore, there is a very good opportunity to invest more in data systems, data visibility, and data use to be able to avail data in a promptly fashion that can be able to, we can be able to sense any changes promptly and make timely decisions.
Great.
Thank you.
Thank you. Thank you. Well, I think we have really now come to the end of the session exactly at 9:50. I want to thank both Alexis and Johnson for having presented today. And again, all of the comments that have been coming through the chat, I'm sorry we didn't have enough time to go through those questions, or even to really address all the questions that I had ready to present to you. But we will get back to people. And as I said, this is really a springboard for ongoing work in the RH community moving forward in terms of addressing COVID. And I want to thank you, both of you, and all of your teams, and Alexis, your team at JSI as well. And of course, the Gates Foundation as well for supporting this effort.